And hello, everyone. Welcome to the Talent Lab podcast. I am flying solo today. Brad wanted me to give the platform all to myself, to pivot into something that I'm really extremely passionate about: giving a voice to women in science. This is the first of hopefully many more episodes we will do where we get to sit down and chat with women in biotech, to hear their stories, learn from their experiences, and elevate their voices. So today I am so excited to continue my conversation with Angeliki Kotsianti. She is a physician scientist, an experienced life sciences executive, an oncology biotech founder, board advisor, mom, wife, global traveler, an all around woman of the world. So, Angeliki, thank you so much for agreeing to chat with me today. Welcome.
Thank you, Marina. Thank you to everybody. And such a pleasure to having this chat, with you today.
Absolutely. So we're going to dive straight in. Everybody wants to hear the origin story. And you've had a really unique career, starting in molecular pathology and diagnostics, then moving into global medical leadership roles. But what originally drew you into that translational space between science and real world impact?
So you call it a unique career, and I understand why it looks that way from the outside. But from the inside, it never felt that was a choice between science and impact. I never thought it as a career choice. I thought it as a conviction. There is a moment in the clinical training where you sit down with the patient and you know that has run out of options. And somewhere in the research corridor, there is a work that could have helped them if someone had closed the gap faster. So I made that decision early on, and I wanted to be that person to close that gap.
It sounds like it's always been your North Star, that patient impact and clinical impact in the end. That is definitely something that I feel very deeply, and I appreciate you articulating it so clearly. So, another thing that really stood out to me, and we're just going to go into those really hot topics, is that you have worked with neural networks really before AI became mainstream. I am very passionate about the intersection of tech and science. So, from your perspective, what drew you in? How did you see the benefit, like maybe earlier than some others? Could you talk to me a little bit about that space?
So people talk about AI in oncology like it's new, right? And as you
Yeah,
said, I did
a
the
little
work,
bit.
20 years ago. What I saw early was simple in my mind. Cancer generates so many more signals, biological signals, right, that any human mind can fully process. So the question was never like the computational tools would transform the oncology. It was when and whenever medicine would be ready. And so I decided not to wait. And being early in that space, it was really tough in a sense. There is a long stretch in between where you have to carry the conviction without the validation. And
Yeah.
that was taught me something about leadership that I could not have learned any other way.
Expand on that a little bit because I think this is a very important point. A lot of times we talk about adapting a company culture based on some of the beliefs that the leadership level or layer carries, and other times this is something when a leader comes into the company, then they absorb the company culture. From your perspective, is it more from the leadership to the company? Is it more from the company to the leadership, or just an amalgamation of the two?
So the leadership inside, for me at least, is the following. The people who shape industries are almost never the ones who move when it was safe. They moved when it was unclear. And they build the credibility to bring others with them later. That's leadership. Being ahead of the
Absolutely.
curve is only valuable if you learn to translate what you see into a language that others can act on, right? Can
Yeah.
really make an impact. And for us, the impact is the patient.
Perspective of innovation and maybe the importance of leadership, do you feel there is a difference between how we approach those questions from either big pharma perspective or small biotech perspective? Do you see that differentiation between the two?
I believe that at the end of the day in medicine, the decision that we have to make is very complex, right? The science is complex, no matter where you're standing in that road, and the stakes are absolutely high because there's no a margin for that is good enough, right? It's zero. You need to do what you can possibly do above and beyond to drive everything and build everything to actually impact patients' lives. There is a patient at the end. And if we remember that, every strategy, every invention, every translational work, whatever you call it, right, will actually lead sometimes slower than others. But at the end of the day, we never should forget that there is a patient waiting on the other end of it. So to me, they are the same.
No, fair enough. I'm not going to put you on a spot and make you pick one or over the other. When it comes to adopting new technologies, because we started chatting a little bit about neural networks and really adopting AI and some technical or technological innovations into the biospace, do you think it's easier to be done by a large big pharma company who has the money to invest into something that may or may not work well? Or do you feel that we're seeing a lot of examples of smaller, maybe VC funded or bootstrap biotechs who are just taking that risk and diving right in to see how they can advance science using tech? What has been kind of your opinion or experience on that?
So there is a lot of, great science that occurs in all levels. Of course, funding, appropriate infrastructure is very, very important. What I have seen sometimes in the biotech companies, or the less exposed companies, to how the whole roadmap is working in order to bring something significant that will impact patients' life, is that they're lacking that understanding to translate the science into a value. And that's the value that you want to change, right? It's like, did
Of
it change
course.
what physician can offer to patient? Did it change what a company could pursue? Did it change what a regulatory, body will approve? If the answer is no, maybe it's just an elegant science. It's not a value.
That's
Um,
true.
so we need to focus on the value of what we try to bring forward.
I know that in our previous conversations, full disclosure, this is not my first chat with Angeliki. There's definitely this theme of bringing value into science, not just generating knowledge, right, but actually bringing something to the patients. So, in this context, how do you define value?
So more more scientists and physicians, misunderstand about that transition, right, of value science, and they believe that their work speaks for itself, but it
Hmm.
doesn't. It never has. The work is the beginning of a conversation, not the conclusion. You have to carry, as a physician, as a scientist, you have wherever you're sitting, right, academia, biotech, big pharma, wherever you're sitting on a board, you have to carry that conversation across the room, across the disciplines, across the functions, across everything, in the most teachable and adaptable way. And then value is not a betrayal of science. You know what I'm trying to say? It's,
Yeah.
I have watched brilliant people resist the translation work because they left it was somehow beneath the research.
Yeah.
They
The
had
work
really,
itself was good enough, and it doesn't
yes,
need to translate into anything beyond the discovery or innovation. Yeah, of course.
exactly. And then, that resistance is expensive for them, for their organization, but ultimately for patients who need that work to move faster.
Yeah. It's really interesting because we will link Angeliki's LinkedIn profile in the show notes, so you guys would be able to see it yourself. But Angeliki, you've spent many years working for Pfizer, one of the most well-respected global biopharmaceutical companies. You have been leader in multiple of their programs. Clearly, built a very deep expertise. So, but you've also kind of operated at that cusp of leadership in science. I see a lot of times I have conversations where leaders who move away from science into higher and higher level of leadership feel a little disconnected from the hands-on work, from the actual value or impact that drew them into it in the first place. So at a certain level, it's almost as if you're deciding, are you a leader or are you an expert? How do you see that juxtaposition? Is that something you've experienced or not?
A lot of, people from outside see the large pharma as, or imagine it, right, as a monolithic decision making
Yeah,
machine, right?
sometimes, yes.
Yes, yes. But the reality is far more human and far more complex. You are sitting at the intersection of science, regulation, commercial pressures, patient needs simultaneously, and often with some incomplete data. And the decisions are never all of them present, right? Never clean enough. So
Yeah,
eh, it means that you need to have that understanding of looking at the assets, the portfolio, the potential medicine, and making judgments about where they're ready, or whether the evidence holds, whether the benefit, it outweighs the risk for a real patient population.
yeah.
That's not a bureaucratic exercise. That is a consequential science with deadlines.
No, absolutely. And I think this is a great segue into something that I always try to advocate for and struggle with, as you probably understand, is that those decisions that happen at that higher leadership level are so pivotal and so important that your decision making power is directly tied to being in that room or not being in that room. Right. And so when we talk about women in leadership positions, and although we have come a very long way, but at some point, did you consciously realize, I want to be in the room where it happens? Like, I want to be, in order for me to impact science the way that I want to impact it, I have to be sitting at that table?
Absolutely. It is. It was a very hard lesson and a very empowering one. And for me, uh, I like to make those calls, those medical calls, right? The benefit risk calls, and to defend them in rooms where everyone had an agenda and the science had to speak the loudest. And the ability to walk in a room, right, and make the stakeholders understand and make the science land. It's it's really a very important skill. However, not being in the room, there was a lot of moments that I remember with clarity that unfortunately the room was, or the decision where I was making, I was not there. Someone else has carried what the framework that I had, um, underpinned for a specific project, a product, a decision, right? And someone else's name was attached to it.
Yeah.
And was not an accident. That was a system working exactly as it was designed to do.
Yeah. Well, I think, and this is something that, again, in a lot of my conversations when I'm working with the leaders who are maybe looking for their next leadership role, when we talk about how we can position ourselves by adding value, a lot of times, if we compare and along the gender line, women are really not taught how to negotiate from the position of power or even how to negotiate in general. I have seen huge leaps and strides that have happened in the last 20 or so years, but we're still not on an even footing. Um, so, having said that, even just when considering women's negotiating power, how they present themselves at that decision making table, where do you think we leave the most on the table or give up in our negotiation skills or aspects? What is it that is holding us back?
So there is a big differentiation between leadership and expertise. Um, Expertise is the entire ticket, right? And but it's not the differentiator. At a certain level, in any room of those that the decisions are made, everyone is accomplished. Everyone has potential. Everyone has done work. What moves you forward from that point is something entirely different. It's judgment, presence, and ability to make other people feel that direction you're pointing is the right one. That is not an expertise. That's a
Yeah.
leadership, right?
Yeah, it's almost like a combination of confidence in your ability and expertise, right? The language with which you speak, which will command attention or make somebody listen. And then maybe awareness of having to prove yourself much more so than maybe some of your colleagues. I mean, is that kind of like where you're seeing that nuance?
You know, it's interesting that you're saying that because women we're over indexing on expertise, right? I would say that with great conviction. I include myself into that, right? I used to do that. And I say that having done it, for years myself. We believe that if we are excellent enough, visible enough in our results, the recognition will follow us naturally. It doesn't work that way. It has never worked that way. Excellence is necessary, but as I said, is not sufficient. What is actually happening is this: we are using our expertise as an armor, right? I am undeniably excellent. No one can question my right to be here. But think about it: carrying armor is heavy. It keeps you at the same place.
Interesting.
And
Hmm.
visibility is not a vanity that like the society wants us to believe in everything, right? It is a strategy. Like similarly, influence is not politics, it's impact. We
I
have
love
to
that.
stop training both as if we're somewhere beneath us, right?
Visibility is not a vanity, it's a strategy. I'm going to remember this for a very long time. Okay. I love that.
And I have watched women that move into real leadership role, not just titles, right, but genuine influence. And all of us, we can think women, not necessarily in the medical field, but anywhere, right, in the world. And all of them, they made one specific choice at that point, and in their lives, they started speaking in rooms before they felt fully ready.
It's interesting you say that because just to kind of tie it back to talent acquisition in my world, and I believe that there's some actual research that has been done on this and actual surveys. Even in terms of applying for roles, women apply to roles where they feel they meet at least 8 out of 10 criteria. When it comes to men, they apply to roles where they may meet half of the criteria that is listed as required, and they feel that their translational skills can bridge that gap. I'm seeing a lot of women be much more hesitant to stretch their own perception of themselves and of their experience. So how do we combat it? Like, what do we do? I'm a Girl Scout leader. I'm a girl mom. She's 10. I'm already telling her that she can do anything, which is great start, right?
Excellent.
But when we're talking about professional women at a certain point in their career who maybe have reached, and this is what we see, a lot of women have gotten to that director level, maybe senior director level. But how do you kick the door into the next decision making pivotal level where your voice, your expertise, your impact will reverberate throughout the system? How do you do it? What's the magic?
um, I will dare say the following: leadership is not a promotion. It is a decision about how you show up every single day in every single room. I have seen in my career directors lead and senior VPs to follow, right? The
Interesting.
title is the last thing that makes you a leader. The decision is the first. And here's the decision that all of us we need to make. Stop waiting for someone to notice you and start making themselves impossible to ignore you.
Love that. I see a lot more of that happening in maybe academia. I have seen a lot of women, many more women are entering STEM careers in general or STEM fields in terms of education. And a lot of them stay in research, stay in academia where they can have that career growth, right? But when we're talking about industry, it is still, I feel, much more disproportionate between women and men in those C level, VP level executive roles. So when you're thinking of that, you've mentioned something in our earlier conversation of portfolio, creating your own portfolio. And just now you mentioned something that you need to be impossible to not notice. So if you were to combine, can you explain to me what you mean by that portfolio work that you need to create for yourself? And then give some advice or ideas how to combine that with that drive of being impossible to ignore, something like an advice for our listeners who may be finding themselves in that space of like, how do I propel myself forward?
I hope that I can inspire some of our audience today. I have given a lot of thought in that perspective. You know, the traditional career, linear career path was never designed with us in mind. It was designed for someone whose trajectory was uninterrupted, whose network was inherited, whose sponsors were already in the room, whose belonging was never questioned. But that is not our story. It never was our story. And yet, I spent decades trying to succeed inside a structure that was built for someone else. And so looking back, no, the linear path does not work for women in the industry. Not because we are not capable of it. Let me be clear on that. But because the linear path requires the system to reward you fairly at every step. And the reality is it doesn't.
Not if you want to have everything, right? Like, not
Right.
if
So
you,
every
yeah.
time, we follow the rules exactly, like exactly as you said, like eight out of the 10, requirements. And we have this education and that, whatever expertise, et cetera, et cetera. And you follow the rules exactly and still get passed over. You lose ground. You cannot recover linearly. The system has too many exit ramps built specifically for us. I wish someone had told me, this early.
That brings me
Yep.
kind of to that question. Is there, I mean, you had to be a trailblazer in a lot of ways simply because, as you said, the system was not designed for someone like you. This is something that you had to navigate, trial and error. So looking back at your career, maybe some of the decisions that you have made, Is there anything that you would do differently if you were to start over again? Is there any advice that you would give your young self when you were starting out? How to do it better, more efficiently, less painfully, maybe?
um, one motto I would use, and it's like, stop waiting for someone to notice and start making yourself, as I said, impossible to ignore. And not and you deserve that seat, whatever that seat is, right? Whatever that your next step, your next leap in your career is, whatever your dreams are, you deserve that seat, not because someone decided to give it to you, but because you build the right to be there. And as we said, the system was not designed to hand it to us. So guess what? Stop waiting. You pull up the chair yourself, you sit down, you do not apologize for it. And when that still doesn't work, guess what? You built your own room. And that's exactly where I am at this moment.
Hmm. I love that. That's a perfect segue because, again, I think the talent market has changed quite a bit. I'm not going to age myself here and say that I've been at it for over 20 years, but the talent market has changed. And one of the things that even us, Brad and myself, are pivoting into is fractional talent acquisition, really breaking down our level of expertise into components that can be digested by themselves by some of our clients who may not need the entire process to be taken care of by a third party, but maybe outsource some parts of it. So I see a lot of biotech, some of the smaller companies are looking for those fractional leadership roles as a way to gain expertise without having to foot the bill for somebody who obviously at a higher level would be asking for a well-deserved but a much higher salary. Give me a little bit about that transition in the biotech space, how fractional leadership is maybe changing the space itself, as well as, and this is the emphasis, I feel like it actually gives more opportunity for women voices to be louder, to be in that advisory capacity, to be able to translate some of their experience, expertise, and pass that along. How do you see that fractional leadership space?
So, in my mind, fractional and portfolio career is not a consolation prize for people who couldn't get the big role. Yeah. It is the most sophisticated career model available right now. And I wish somebody had told me that early on, that I should have started building it long time ago. And the women who understand that earliest, we have the most leverage. You're not choosing between a career and a portfolio. You're choosing between someone else's architecture and your own. And the most important thing, the portfolio has value that compounds, diversifies, and protects you when one piece shifts, right? Like, we're living in an environment that it is really can change from one moment to another. When you build that way from the beginning, your career is an asset portfolio. It's not a ladder. A ladder has one direction and one path, not your career, right? So you have your
Yeah.
optionalities, you have your expertise, your network, your IP, your advisory capacity. These are assets. This is a strategy that all of us we need to follow. Start treating them as such before you need to, because the moment you need them is always too late to start building that. I don't want to be pessimistic, but it's going to be harder. You understand what I'm trying to say?
Yeah, I mean, I think it's such a valuable advice because we really think of ourselves more as a combination of our experiences versus the combination of our skills. And the way that you're almost merging the two, or kind of, yeah. So the fractional value of my expertise in this area, the builds my portfolio. I'm an expert in this. I'm an expert in this. I can give this. So it's not that I can just do fractional advising to multiple companies based on the totality of my expertise, but each component that I have acquired through study, through experience, is a value in and of itself. Is that how you would break that down? Am I understanding it correctly?
That's exactly correct.
Okay.
And think about the value and the impact, the multiplication, the ripple effect that you will have, because you're not any longer, within boundaries, right? With frame.
Interesting.
You have now really grow through your career, through your expertise, through your different positions, and everything else that is happening to us, right? Like, we are growing up and collecting wisdom, information, skills, and expertise that now we can give it back and have an impact in so many different levels.
I love that. And then seeing how this is our first of, as I said, hopefully many episodes when we talk about women in science and how we can help pave the way with even the smallest cobblestone. So in practice, if you were to, if somebody came to you, as I'm assuming you mentor a lot, a woman early in her career comes to you right now and says, Angeliki, I'm very passionate about this space. I love how you broke down this portfolio in value add. What can I do now? What are some practical things? Where do I go? Who do I reach out to? Do I write a list of the things I can do? Like, how do I get started? What is the practical advice that anybody can take on today?
I would say the first advice I will give, it's start building your independent platform, portfolio, career, whatever you want to call it, now. The right moment is now for the right, not, I waited for the right moment, the right title, the right level of permission. No, no, that was not wise. The right moment was always now. It always is. So that's one advice I would give to our, audience here. The second thing, I think, it's that women, and you touched upon in a previous question, we're leaving a lot on the table before even the negotiation begins. We accept the first frame. We negotiate within the boundaries that someone else set without ever questioning whether those boundaries are legitimate.
Yeah.
The most expensive moment in any negotiation is the one before we open our mouths, when we decided
True.
what we're willing to ask for, right?
Yeah.
And unfortunately, most of us have already discounted ourselves before anyone else has said a word.
Yeah. Yeah. Interesting. It's such a, don't come at me for this, but it's such a volatile topic too, because if we come across too assertive or we're instantly deemed difficult to deal with or dismissed with with prejudice, I suppose, right?
Yeah.
So how do you walk that fine balance? Is it a matter of honing your communication skills? Is it frankly, maybe I'm in the wrong? Maybe we just need to be matter of fact about it instead of constantly trying to think back to like, well, that's not how we used to do this. There may be some barriers to this. Forget about all that. Just dismiss it all and just act as if you already are in the room and have that seat. Would that be something that you think is implementable in the biotech space for women? Or is it not ready for it quite yet?
I would say, I will be a little, optimistic in that, right? It is a matter
Yeah.
of conditioning. Is it confidence, language, awareness? structural, right? It's all of those things. And if I wanted, that's why I call it, conditioning. We have been taught explicitly and implicitly that asking for more is aggressive, that
Yeah,
knowing
we have
your
that
worth,
Pavlovian response to it.
yes,
Absolutely. Yeah.
yes,
You're going to be called a B word or whatever
uh,
other word if you speak up too much or yeah, come across as aggressive. Sure.
thank you for filling the blanks for me on that.
Yeah.
I wanted to be,
No, I will take the brunt of it.
So knowing your worth and stating it, plainly makes you difficult, right?
Mhm.
That being easy to work with requires being easy to underpay, and
Yeah. Yeah. We're
that
still definitely
conditioning,
not equal in terms of that. Yeah.
right? And that conditioning is not a personal failing. It is a system that was designed to keep us negotiating against ourselves.
Yeah.
So start conditioning ourselves different, right? The language piece is real and very specific. We qualify, we heads, we say, oh, I think and perhaps, and, it would have been possible,
Yeah.
in moments that we need to declare things. And it's not because we lack conviction we don't say those things, but because we were taught that conviction without softening is threatening, right?
Yeah. It's so I think I have come to realization that at some point we just need to forget about what was before, but we need to forget about that there still may be some of those prejudices and maybe unfavorable thinking about assertive women, and just act the way that we are, the way that our expertise allows us to do. We just walk into a room and pull up a chair, exactly as you said. And maybe it's the girl mom in me, maybe it's the science nerd, but genuinely seeing a former Girl Scout, a woman in space orbiting the moon, and inspiring my little girls in the Girl Scout troop that I lead with how optimistic we need to be and how we can work together. And of course, the unity of the crew was absolutely amazing to see, but just the humanity and having that seat in at the table or in a space capsule uh, is such an inspirational and optimistic vibe, that I'm still riding high on that. So if we were to look forward, are you optimistic where we're heading? Do you see a brighter future for women in science, women in biotech, women getting to those decision making tables and sitting it down permanently?
So am I optimistic? Cautiously.
Okay. Okay.
And I choose that word deliberately. Uh, I have watched this industry congratulate itself for decades. Diversity, initiative, inclusion, pledges, keynote speeches about change. We all have heard, while the numbers at the top barely moved. Optimism without accountability is just a better story about the same reality.
Yeah. So then what needs to happen? What do you
So,
feel
yes,
like?
I'm optimistic, but I'm the kind of optimistic that comes with expectation and a scorecard, right? Um,
Yeah, it has to be measurable differences, not just something that, again, yeah, it's not just vibes. It cannot be just vibes. It needs to be something concrete, something measurable, and that needle needs to be moving, maybe at a faster speed, but definitely a measurable speed. What can you and I know each other for a little bit now, but what can I do as a woman that's in a tangential relationship with science, but who interacts with a lot of women in science? Um, how can I make the world a better place from the podium that I have? What advice would you give me?
so I would say to you and to me and any woman that actually listen to us who have made it, we have a specific responsibility. Stop being so careful. Stop managing
Caution
our
to the wind. Okay. All right.
Stop managing our image so precisely that you never say the thing that needs to be said.
Okay.
Name what happened to you. Say it plainly, not for yourself, but for the women who is sitting where you were sitting 15 years ago, 10 years ago, whatever it was, wondering if it is her fault, wondering if it's she's imagining it, wondering if she should just work harder or wait longer. This is our responsibility, right?
Love that. I think yeah, be a sister to every Girl Scout, and in this particular case, be a sister to every woman who is standing beside you in whichever vertical capacity, whichever industry, and extend a helping hand, even when it's not being asked for, or propel their voices and their opinions. Okay,
And create your own room, right? I mean,
yeah,
the question I ask myself often, are we heading in the right direction? Yes.
okay.
Fast enough? No. But but I'm not waiting for the industry to move at its own pace, right? I never have, and neither should you. Neither anyone who is listening to us right now, or any young person that comes to our family gatherings, the scouts, the whatever is our micro environment. No, we should stop waiting. We should stop waiting for permission. We should stop waiting for the industry for whatever what is to move at its own pace. We dictate the pace.
Yeah, I love that. This has been, again, so inspirational. Every time I talk to you, I just get this burst of energy. I just want to go out there and change the world, help somebody, kind of renew my faith in the fact that we are going into the positive direction. We are making those, however incremental, but still changes that are going to benefit us all. Is there anything else that you'd like to add that we may have missed? Is there anything else that you just wanted to leave us with?
One thing I would like to say will be to dream big. Don't allow anyone to discount your dreams, and keep your failures and successes together. Failures, they're there to be a foundation for us to build our next self. What defines us is how we deal with our successes. Is there humility there? Is there an understanding? And you know what? When you have the successes and the failure, and you are in that middle line, always you get up faster, always you get up stronger. So don't be afraid to try. Don't be afraid to follow your dreams. Don't allow anyone to discount you. And with tenacity and smart work, not harder work, right? You will make it. You will make it to the top. You will make it to wherever your desire and your calling is in this life.
Everyone, I could not say it any better. Angeliki, you have been a marvel. I am so grateful for your time. And to everyone, thanks for tuning in to another episode of the Talent Lab. Bye.